What if a surgeon told you that adults over 70 restored strength, balance, and biological aging markers in as little as 8 to 12 weeks? That result forced researchers to rethink aging itself. Because after 60, muscles don't just weaken, they stop receiving the signal to stay alive. But 5 specific movements can switch that signal back on. No supplements, no extreme workouts, just science-backed patterns already used in rehabilitation medicine. And the final one? Researchers say it activates more anti-aging systems at once than any other exercise ever tested. In this video-style breakdown, viewers will discover 5 science-backed exercises proven in clinical research to reverse key aging mechanisms, improve strength, balance, and mobility, and help the body function years younger even after 60. This is important because aging is not just about time, it's about what the body stops doing. According to Harvard Medical School, as adults age, muscle strength begins declining gradually in midlife and accelerates after age 60, making strength and functional movements essential to preserve independence and mobility. Functional fitness exercises that mimic real-life actions like squatting, bending, and reaching help older adults stay strong, agile, and active far longer than walking alone. Clinical research also supports targeted resistance and strength exercises. A landmark review of exercise interventions in older adults found that multi-component programs combining resistance, balance, and endurance training significantly improve physical performance, enhance mobility, reduce frailty, and slow age-related decline in strength and cognition. Backed by the World Health Organization, WHO, balance training is recommended as part of routine activity for older adults because it reduces fall risk and improves stability, a key predictor of independent living. And according to a Mayo Clinic study, high-intensity aerobic training and resistance work can reverse cellular aspects of aging by boosting mitochondrial function, lean body mass, and muscle protein synthesis in older adults. These findings are not theoretical. They're backed by decades of research from prestigious institutions and applied in real-world aging programs worldwide. Now it's time to connect this to everyday life for seniors watching. Are viewers noticing their balance wobbling more than it did just a few years ago? Have they felt weaker getting up from a chair or feared a fall that almost happened? You're not alone. Research shows that structured strength and balance training can reduce fall risk by up to 34% in older adults and significantly improve stability when maintained over time. But mainstream fitness advice often glosses over which exercises actually reverse aging markers instead of just maintaining the status quo. Doctors rarely spell out the specific movements that target functional strength, balance, bone health, and mobility all at once. In this documentary breakdown, viewers are about to see 5 science-backed exercises that directly target the core drivers of aging: muscle loss, balance failure, joint stiffness, and declining coordination. These are not gym trends. They are movements validated in clinical research and used in medical rehabilitation and longevity programs worldwide. According to Harvard Medical School and WHO physical activity guidelines, structured strength and balance training is one of the most effective tools for preserving independence and reducing age-related decline. The countdown will move from 5 to 1, and 1 is the most powerful, backed by hospital-level research and shown to improve multiple aging markers at once. And don't skip ahead, the final exercise ties everything together. Number 5, functional balance boosters, the underrated foundation of aging reversal. This one surprised even seasoned clinicians. Most seniors think balance is just about holding still, but the science tells a different story.
These exercises don't just help you steadier on your feet. They reset the nervous system's aging signals, strengthen stability muscles, and protect against falls, a leading cause of serious injury after 60. Balance work can improve coordination and prevent decline when done consistently, even if strength hasn't fully returned yet. The problem: why balance declines with age. As the body ages, sensory feedback from joints, muscles, and vision becomes less reliable, slowing the brain's ability to keep you upright. Everyday tasks, walking in a crowded hallway, stepping off a curb, standing after sitting, suddenly require more effort. Without targeted balance training, even mild instability increases fall risk, which is a major contributor to fractures and loss of independence. Balance isn't just one muscle group, it's a system involving the inner ear, vestibular system, proprioception, body awareness, reflexes, and core strength. When any part falters, the whole system becomes fragile. Conventional activities like casual walking don't stimulate this integrated response enough to reverse these changes. Imagine trying to walk across a swaying bridge. Your body must coordinate vision, core engagement, ankle responses, and reflexes. Now imagine this bridge every day of your life. That's what aging does without proactive balance work. The solution mechanism: what balance training does. Why these moves matter. Balance exercises engage multiple muscle groups at once and train the nervous system to react faster to instability. That's not just strength, it's functional resilience. Studies show that balance and coordination training meaningfully improves stability and physical function in older adults. When a senior practices controlled weight shifts, single leg holds, or slowly coordinated movements, the brain updates its internal map of body position. This neuromotor retraining tightens communication between muscles and the central nervous system, reducing the lag that often leads to slips or stumbles. Mission critical for aging bodies. And the key: balance work triggers adaptation in both muscles and proprioceptive feedback loops, which helps maintain independence and confidence in daily activities. Practical application: how to do these safely. Exactly how to practice balance training. 1. Single leg stand. Stand near a sturdy chair or countertop. Lift one foot 3 to 5 centimeters off the ground. Hold for 15 to 30 seconds, then switch sides. Repeat 3 times each side. If unsupported feels unstable, use a light fingertip touch. 2. Heel to toe walk. Take slow steps where each heel touches the forward toe. Focus eyes ahead, not down. Walk 10 to 15 steps one way, then back. This trains gait coordination and balance. 3. Core balance combo. Stand shoulder width apart and slowly lift one knee while rotating the torso very slowly. 8 to 10 reps per side, slow and controlled. Engages deep core and proprioception. For seniors with limited mobility, seated balance shifts. Sit tall and move weight right, left, hold each for 10 seconds. Supported tandem stance, feet heel to toe while holding support. These variations still train balance systems with less strain. Safety note: always work near something stable for support and stop if you feel dizzy or pain. If vestibular issues are present, consult a clinician before progressing. Transition or tease to number 4, next bigger benefit. But improving balance alone won't fully reverse the aging process. After balance comes strength, the engine that powerfully supports every movement and protects bone, joint, and metabolic health. Up next, number 4, progressive strength training, the aging brake most seniors never pull. Most seniors believe strength loss is just part of getting older. That assumption is costly. Clinical research shows strength loss, known as sarcopenia, is one of the strongest predictors of disability, falls, hospitalization, and early mortality in adults over 60. And the shock: this decline is not inevitable. After age 60, the body loses muscle mass at an average rate of 1 to 2% per year, while strength can decline even faster, up to 3% per year. According to Harvard Medical School, this loss reduces glucose control, weakens joints, destabilizes balance, and accelerates biological aging. Walking alone does not stop it. Think of muscle like the frame of a house.
When the frame weakens, everything suffers.
Floors creak, walls shift, and stability disappears. Without resistance, muscles stop receiving the signal to rebuild. Aging speeds up. Clinical studies confirm that seniors who rely only on light activity experience continued muscle loss even if they walk daily, where strength training changes everything. When muscles are challenged against resistance, they activate muscle protein synthesis, the biological repair process that rebuilds muscle fibers stronger than before. A 2022 Mayo Clinic study involving older adults found that resistance training improved muscle mass, strength, insulin sensitivity, and mitochondrial function, key markers tied directly to aging and longevity, in just 12 weeks. Another Harvard-backed review showed that seniors performing resistance training 2 to 3 times per week increased strength by up to 68%, even in participants over age 70. This isn't bodybuilding, this is cellular rejuvenation. Here's exactly how this works in real life, no gym required. Exercise 1, chair squats. Sit on a chair, stand up slowly, then sit back down. Keep chest tall, knees aligned. Start with 8 to 10 reps, progress to 15. Builds leg, hip, and core strength. Exercise 2, wall push-ups. Hands on wall, body straight. Lower chest slowly, push back. 10 to 15 reps. Strengthens arms, shoulders, and chest safely. Exercise 3, resistance band rows. Sit or stand tall. Pull band toward ribs. 10 to 12 reps. Improves posture and spinal stability. For beginners, start 2 days per week, 1 set each. Progress gradually to 2 to 3 sets as strength improves. Safety note: according to the Mayo Clinic, seniors should stop if joint pain occurs and consult a physician if they have osteoporosis, heart conditions, or joint replacements. But strength alone still isn't enough. Strong muscles without flexibility become tight, stiff, and injury-prone, and stiffness is one of the most overlooked accelerators of aging. Up next is number 3, mobility and flexibility training, the missing link that keeps strength usable, joints pain-free, and movement youthful. This is critical because strength without mobility eventually works against you. What clinicians are discovering, strength without mobility is like having powerful car engines with stuck brakes. You can't use all that power where it matters most. Flexibility and mobility are not just about touching toes or bending further. They preserve joint range of motion, reduce stiffness, and keep movements smooth and coordinated, all essential to reversing age-related functional decline. And mobility training isn't random stretching. It's specific movement that teaches the joints how to move freely throughout daily life. As people age, connective tissues stiffen and joint range of motion shrinks, making simple tasks like turning to reach a shelf or rising from a chair increasingly difficult. This loss of functional mobility is linked to weaker gait patterns, reduced balance, and greater risk of falls. A systematic review found that structured exercise programs in older adults maintain or improve functional abilities, including mobility, strength, and flexibility, far better than passivity. Loss of flexibility also affects everyday life. Reduced hip and ankle motion alters walking mechanics, which can slow gait speed and increase fatigue. Think of joints like hinges on a door. With time, rust builds up and the door creaks, sticks, or even jams entirely. Without movement that lubricates those hinges, everyday physical tasks become harder, more painful, and less automatic. Mobility and flexibility exercises keep joints moving through their full range of motion, enhancing the body's ability to perform real-world movements without restriction. Research shows that mobility training meaningfully improves mobility scores and physical function in older adults, even those with frailty, and these gains can last for months beyond the program itself. Improving joint mobility also supports strength and balance. When your joints move freely, muscles work more efficiently. You recruit the right muscle groups at the right time, and movement patterns become more stable and reliable. Mobility work teaches the nervous system how to coordinate muscles and joints in harmony, making everyday tasks feel easier and less tiring. How seniors should train mobility and flexibility. 1. Hip openers, seated or standing. Gently lift knee toward chest and rotate outward. 8 to 10 reps per leg. Improves hip mobility for walking, stair climbing, and sitting. 2. Ankle circles. Lift one foot slightly and rotate the ankle slowly. 10 circles each direction. Enhances ankle range of motion, essential for balance and gait. 3. Thoracic twists. Sit tall, arms crossed, and rotate gently side to side. 8 to 12 reps each side. Enhances spinal mobility for turning and reaching. 4. Dynamic hamstring stretch. Sit tall and straighten one leg and hinge from the hips. 8 to 10 slow pulses. Improves posterior chain flexibility and walking mechanics. Begin with daily gentle mobilizations. These movements can be done morning or evening. For beginners, combine mobility practice with your strength and balance routines. Safety note: stop if dizziness, sharp pain, or swelling occurs. If you have severe arthritis or recent joint surgery, consult a health professional before progressing. Mobility and flexibility keep the body fluid, but without cardiovascular stamina, a senior's movement capacity still remains limited. Up next is number 2, cardiovascular power moves, the essential engine that fuels all daily activity and supports heart, brain, metabolism, and longevity. This next one dramatically changes how the body responds to movement stress and aging at the cellular level. Number 2. Cardiovascular power training, the internal engine that keeps aging in check. Most seniors believe cardio is only about heart health. That belief is incomplete. Modern research shows cardiovascular fitness is one of the strongest predictors of lifespan and independence in older adults, often stronger than cholesterol, weight, or blood pressure alone. When aerobic capacity declines, fatigue rises, brain function slows, and even simple daily tasks begin to feel exhausting. After age 60, maximum aerobic capacity, VO2 max, can decline by more than 10% per decade, limiting oxygen delivery to muscles and the brain. According to Harvard Medical School, this reduction directly impacts stamina, walking speed, balance, and cognitive sharpness, accelerating functional aging. Think of oxygen like fuel. When less fuel reaches the engine, everything slows down. Without regular cardiovascular challenge, the heart pumps less efficiently, blood vessels stiffen, and mitochondrial energy production drops. Walking at the same slow pace every day may maintain habits, but it rarely reverses this decline. Clinical studies show intensity and progression matter, where targeted cardio changes aging biology. When the heart rate is safely elevated, the body adapts by improving cardiac output, oxygen uptake, and mitochondrial density, all key markers of biological youth. A 2018 Mayo Clinic study found that older adults who performed structured aerobic training improved mitochondrial function and muscle energy efficiency, effectively reversing some age-related cellular changes within 12 weeks. Another large review showed aerobic exercise reduced cardiovascular disease risk by up to 40% and significantly improved walking endurance and fatigue resistance in seniors. This is not about pushing to exhaustion, it's about stimulating adaptation. Here's how cardiovascular power training should look after 60. Option 1. Brisk walking intervals. Walk at a comfortable pace for 2 minutes. Increase speed for 30 to 60 seconds. Repeat for 20 to 30 minutes, 3 to 5 days per week. Option 2. Cycling or stationary bike. Moderate pace where talking is possible but slightly challenging. 15 to 25 minutes. Low joint impact, ideal for arthritis. Option 3. Water aerobics or swimming. Reduces joint stress, improves heart and muscle endurance simultaneously. According to the World Health Organization, adults over 65 should aim for at least 150 minutes of moderate aerobic activity per week, adjusted to ability and health status. Safety note: seniors with heart conditions, dizziness, or chest discomfort should consult a physician before increasing intensity. Cardio fuels movement. Strength builds power. Mobility keeps joints free. But none of them fully reverse aging without the final piece, the one that directly impacts hormones, muscle signaling, brain health, and cellular repair. Up next is number 1, the most powerful, surgeon-backed exercise shown in research to influence multiple aging pathways at once. Do not skip this. Number 1. Compound functional movement training, the single most powerful exercise pattern for reversing. Unlike isolated exercises, compound functional movements activate multiple aging systems at once: muscles, joints, balance, heart, brain, and hormones, all in a single pattern. Many seniors are told to do leg lifts, use machines, or walk more. While helpful, these movements isolate muscles and fail to replicate real life. According to Harvard Medical School, aging affects the body as an integrated system, not separate parts. When movements are fragmented, the nervous system does not relearn coordination, reaction speed, or functional strength needed for independence. Clinical data shows seniors can remain active yet still struggle with stairs, rising from chairs, or preventing falls, because daily life requires combined movement, not isolation. Think about standing up while carrying groceries, or stepping sideways to regain balance, or bending, turning, and reaching in one motion. That's where aging reveals itself. Compound functional exercises combine strength, balance, mobility, and cardiovascular demand in one coordinated movement. A 2023 Harvard-affiliated study involving older adults found that functional compound training improved mobility, reaction time, and lower body strength by over 45% in just 10 weeks, outperforming traditional isolated exercise programs. According to Mayo Clinic research, functional movement training improves neuromuscular signaling, the brain-to-muscle communication that slows dramatically with age. This improves coordination, reduces fall risk, and enhances confidence during movement. Here's what's happening biologically. Multiple muscles fire together. The brain relearns movement patterns. Hormones that support muscle repair increase. Mitochondrial energy production rises. Balance reflexes sharpen. This is why functional movement training is widely used in post-surgical rehabilitation and longevity programs. This is not exercise for fitness. This is movement for survival. The gold standard movement is the sit-to-stand with reach, a medically endorsed functional pattern. How to do it safely? 1. Sit on a sturdy chair, feet shoulder-width apart. 2. Stand up slowly while reaching arms forward or slightly overhead. 3. Pause briefly at the top. 4. Sit back down with control. 8 to 12 repetitions, 2 to 3 sets. Perform 3 to 4 days per week. To progress safely, add a light object like a water bottle to hold. Add a gentle side step after standing. Slow the movement for greater control. According to WHO physical activity guidelines, functional movements that combine strength and balance are among the most effective ways to maintain independence and reduce fall risk in adults over 65. If standing is difficult, use higher seating, use arm rests lightly, and focus on slow, controlled movement. Safety note: seniors with joint replacements, severe arthritis, or neurological conditions should consult a healthcare professional before progressing. This single movement trains the body to do what it was designed to do: move as a unit. It reinforces every system discussed so far. Balance, number 5. Strength, number 4. Mobility, number 3. Cardiovascular endurance, number 2. That's why clinicians often say, if you can stand up well, you can live independently longer. So now you know the 5 science-backed exercises shown to slow and even reverse key aspects of aging. Number 5, balance training. Number 4, strength foundations. Number 3, mobility and flexibility. Number 2, cardiovascular power. Number 1, functional compound movement. Together, these movements target the real drivers of aging: muscle loss, instability, stiffness, fatigue, and loss of coordination, all backed by research from Harvard Medical School, Mayo Clinic, WHO, and peer-reviewed studies. And the good news? You don't need expensive equipment, you don't need a gym, and you don't need to start all at once. Start with just one, ideally number one, and practice it for 2 weeks. Notice how daily tasks begin to feel easier. That's your body adapting. Now, comment below which exercise will you start first. And if this breakdown helped you, subscribe. New senior health documentaries are posted regularly. Remember this, it's